And so let's talk a little bit about the treatments. So tell us, Dr. Wang, what have you been doing to care for these patients?
Yeah, these patients really require a multidisciplinary effort to optimally treat them. So it's not just infectious disease doctors out there, but um, because this is primarily a disease of the lungs, pulmonologists and ICU doctors are very, very instrumental in the care of these patients. Um, uh, and something that needs to be emphasized is that because this is a new virus and we don't have a history of dealing with this virus, everything right now is really very much in process. We are really learning how to treat this virus in real time. And so we learn basically day to day, month to month. So a typical day in my work while treating these patients, there is a dedicated wing within the hospital that houses these patients, and the purpose of that is to separate them from the non-COVID patients to try to reduce transmission within the hospital. So first thing before we enter that wing, we have to get in our proper protective equipment. We have to make sure that we are wearing appropriate masks, eye protection, and then if we have face-to-face interaction with the patients, then gowns and gloves as well. And then really, I join my team, the ICU doctors, the nurses, the respiratory therapists, the pharmacists, and we start our rounds. And so what that is we then go from room to room, bedside to bedside, and discuss each individual patient and where they are in their disease process. And then we discuss various strategies. The ICU doctors will focus heavily on the ventilator management and how to best oxygenate these patients. And then I will help make decisions regarding specific treatments to give them to try to damp down either the virus itself or the immune response to the virus.
One of the medications that we've heard a lot about in the news is um, hydroxychloroquine. What are your thoughts about that?
Yeah, hydroxychloroquine has gotten a lot of airplay, um, mostly because it has shown in vitro, that is not in actual patients, but there's been some cell culture data to suggest that possibly could inhibit SARS-CoV-2 replication. It's actually a very old medication that has been used for a variety of different diseases, mostly autoimmune diseases such as lupus and when SARS-CoV-2 first came out, this kind of quickly became a drug of choice. But we're starting to get data back from various trials to suggest that there really is not that much clinical benefit. So even though there may have been an in vitro possible mechanism, we're not really seeing it play out in actual people. Now, because this virus, this pandemic is playing out in real time, we don't have huge trials to really guide us definitively, but all the little incremental bits of data that we have so far seem to suggest that it's not helpful. And many people are actually starting to move away from using it. And you may ask, well, what's the harm? If there's a possibility, why can't we just give it? Hydroxychloroquine isn't a completely benign drug either. There are potential toxicities that can be associated with it, including possible cardiac toxicities and visual toxicities. And then there's also the broader agenda of a limited supply of medication. There are other patients who legitimately do need this medication. And if we use it all up for questionable purpose in these COVID patients, then we may have a shortage for the patients that actually do need them.
Great, thank you. We have a question from our audience. Would it be harder for a person to recover from COVID-19 if they have asthma?
Yes, so all the data that we have right now suggests that those who have chronic lung conditions tend to have more difficult courses with COVID-19. Now, it's hard to extrapolate the larger data to individuals. So we also know that young people tend to do better with COVID-19 as well. So if you're a young person with asthma, where does that leave you? It's hard to say. But yes, in general, lung diseases such as asthma, COPD, these things tend to prognosticate more poorly than those without lung disease.